Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Trimethadone. Trimethadone is no longer used nowadays. Why? Because trimethadone causes a serious adverse effect which is called as reversible hemeralopia. This reversible hemeralopia. This reversible hemeralopia is nothing but the patient will develop glare effect and photophobia. Because this the patient will develop glare effect and photophobia due to the effect of the drug on the neural layers of the retina. Because of the effect of the drug on neural layers of the retina, the patient will develop reversible hemeralopia. So because of that, this trimethadone is no longer used nowadays.
thank you and thank you for watching.